All right, good morning, everyone. My name is Chanel Cook. I'm the Chief of Communications here at the Atlanta VA Healthcare System. We are going to go ahead and get started. We thank you for your patience. We also thank you for your attendance, and of course, we always thank you for your service. So this morning, you're going to hear from presenters, and then we're going to hear from you. That means the folks who are in the room as well as the folks who are joining virtually. The Q&A is at the end, and we hope that you save your questions during that time, and we'll do our best to connect you one-on-one with folks, as well as provide some resources. For those who are in the physical room, we do have resources in the rear, so if you did not obtain any on your way in, please feel free to take some when you depart. And then for the folks who are joining us virtually, all of the links and telephone numbers that are shared here today on every single slide will be shared in the chat. Additionally, the recording of the town hall will be posted next week on our YouTube and Facebook pages. So the reason that we do this is because if any veteran overshares information, too much detailed information during the Q&A, we want to make sure that we do our best to respect everyone's privacy. With that in mind, we do ask that you please limit the sharing of detailed information. When we get to the forum, what we would like to do is make sure that we set you up with someone that can talk to you one-on-one. And then my last alibi before we get underway is that we do have a claims clinic in the atrium for those of you who are here in person. So there are also additional resources out in the atrium. This is the agenda. For those of you who are in the room, you have one physically, and then those who are, joining us virtually, we are going to keep the order as best we can, but due to some unforeseen circumstances, some of our presenters are not going to be able to join us this morning, so we're going to be flexible and go with the flow. So first, we're going to hear from a member of our executive leadership team. Ms. Danielle Terrell is our Interim Associate Director of Outlying Sites, and she is going to be the first speaker this morning. Ms. Terrell?
Good morning, everyone. Good morning. Good morning. Okay, that was pretty good. Good morning, everyone.
Good morning.
All right, as vets, we wake up early, right? I appreciate everybody showing up this morning on a Saturday for sure. Just to let you know a couple things, we got some really great stuff happening at the Atlanta VA. The first thing is we're going in the future to be moving this event to during the week where our veterans are already in our building, so we can make it more on your schedule with your convenience, and we think that's a really awesome thing. As a veteran, I appreciate that, so we'll make sure we get that posted, and so you can, come to the VA on a regular day. That way more staff can be here with more flyers, more information, provide you real-time assistance, okay? So that's my big kudos announcement. So a few things happened this week. There's a lot going on at the Atlanta VA. But I'll tell you, we had a couple site visits this week. The first one was for our Gero Fit program, and you'll be hearing more about that. So we have a Gero Fit program that is all about improving your lifestyle, getting more fit, staying more active, staying out of the hospital, improving health outcomes. And we've been looking to expand that program. We're one of, I think, 22 sites of care that offer the program, so it's a pretty awesome opportunity for us. And they came to evaluate our program and tell us all the wonderful things that we're doing. And it was a really impressive site visit, so that was exciting. The other thing is we got selected by the OIG to come and do a medical records visit. For those of you that know that that's not so exciting of a topic. For community care, for internal medical records, we're going to work with the national office to be a part of the change to improve, to add software, to use technology to improve the process, to maybe change some of the regulation around medical records management so that we can get test results sooner and get you to the next phase in your clinical care. We had a site visit for compliance with our health administrative services, which is wonderful. There's a lot of changes happening in our HAS. Those are our frontline schedulers and eligibility. Major improvements from last year to this year. We still have so much to do, but we're really proud of the team for all the improvements that they've been able to make over the last year since the last time that the network office was here to look at our programs. And we had a visit from the National Artificial Intelligence team. So we are going to be a pilot site for implementing artificial intelligence to improve a lot of processes within the VA, not just the Atlanta VA, but across the VA network. And so there's some really cool opportunities. One of those is using artificial intelligence to help with medical records management, so tying those two initiatives together. We have the largest volume of medical records in the nation that come in, so we're the perfect site to test this out on, because if you can use artificial intelligence to improve the care at the largest site of medical, then it will work at every other VA. So we're really excited about all those initiatives. We have some other things coming down the pike with some new construction for some new buildings that we're going to be doing, consolidation projects, those types of things. So in the next 4 to 5 years, the footprint of the Atlanta VA is going to look a lot different. So that's just kind of an update on what's going on here, and I hope you really appreciate the presentations we have today. Remember, we did mention that there's flyers in the back, but we also have subject matter experts in the room if you have questions or you have any concerns that you would like us to address. Thank you.
All right, thank you, Ms. Terrell. Our next presentation is going to be from our Health Administration Service, and our acting chief is Mr. Terrence Richard.
All right, good morning, everyone. So, just going to give you a relatively quick update on some things that HAS has been doing to improve services for you. First one is related to Benny Travel. So, we have replaced our legacy Benny Travel module with a more modern cloud-based system. The biggest key here is that this new BTSSS system helps us to consolidate things, helps us with eliminating fraud, waste, and abuse, and helps drive the electronic funds process. It's self-adjudicating system, so it automates a lot of the work, takes a lot of the time that it takes to process claims out of the process. So it really is a great tool for us. So for those of you that may not be signed up for BTSSS yet, there are some steps that you need to take to make sure that you can enter a claim with us and receive that electronic payment timely. So first step is you need to give us some direct deposit banking information. So I'll take this time to just let everybody know that the VA is on its way to being cashless. So we do not carry a lot of cash here on site the way that we did in years past. We also do not provide checks the way that we did in years past. So it's going to be important for everyone to give us direct deposit information so that if you're filing a travel claim or doing some other things that require us to make a payment to you, including if you come in with, large sums of cash or anything like that as an inpatient, we will be returning those funds to you electronically through direct deposit. All right, so that's a very big step here to make sure that you get paid timely and make sure that we can process your claims as quickly as possible. The second is you need to upgrade to a premium My Healthy Vet account. You can create that at ID.me. I believe we'll drop the link in the chat for some more information and to get you to where you need to be to make those upgrades to your My Healthy Vet account. Then when you log into BTSSS for the first time, you'll create a profile. Make sure that direct deposit information is in there. It's going to be important, again, to make sure that we can get the funds to you quickly. Most veterans, when you come into the VA, know about what they're eligible for. We offer 2 types of travel benefits. There's the Benny Travel program, which pays for travel to appointments and other things related to your care. Then there is special mode transportation, which is direct transportation to care for those that need assistance. So if you fall into either one of those categories, or you have questions about which category you fall into, we do have our eligibility team that is down at the other end of the hospital here on the first floor in our welcome center. They can give you more information. We have our transportation folks that are around in that area as well. So if you go over there, you'll see 2 windows. There are transportation assistants that can help you determine what eligibilities you have. That's also a conversation that you can have with your providers. So, do you have to use the BTSSS system? No, but I strongly recommend that you do. The only other option for filing a claim right now is giving us a paper form. I will tell you that there is a long lag time on those paper forms because they do require a lot of manual manipulation to get them into the system and get them paid, because we still use this BTSSS system even to pay those paper claims. So it's just going to extend the amount of time that it takes for us to get you your funds. So quickest way to get your funds is to file it electronically, but it's not your only option. So another thing that we're working on to improve service to our veterans here in HAS is we are implementing our patient scheduling center. So that is our newest call center that we will have to support our specialty services here at the Atlanta VA. That call center is already taking calls for mental health, radiology, surgery, and audiology. We are actively working to get it up and running for the remainder of our medical specialties. The goal there is to improve our telephone timeliness. We've heard the complaints over the years about how hard it is to get in contact with us, and we're working diligently to improve that. This is one of the things that we're doing to improve that. There are several other projects surrounding this that we hope to have take place over the next year to really improve the timeliness and your access to the system by phone. So right now, calls are taken 24/7. If you give us a call, it'll go somewhere, right? And someone will answer that phone. We'll do our best to answer that phone, especially if you're calling our main line. If you call direct extensions, there may not be anyone that does direct extensions, but if you call a main line, we're here 24/7 for you. The patient scheduling center will operate from 8 a.m. to 4 p.m. for all services except for mental health, which start at 7:30. All right, so there's no special numbers to dial. We're working to make sure that when you call the main number to the hospital, you choose your prompts and it'll direct you where you need to go to get you into the patient scheduling center and other places that you're trying to call around the medical center. All right, and that's all that I have.
Thank you so much, Mr. Richard. Next, we're going to hear from Dr. Elizabeth Hollis, and she is our Acting Chief of VA Community Care.
All right, good morning, everyone. So I'm Elizabeth Hollis, Acting Chief of Community Care, and I'm going to talk to you about some of the veteran responsibilities for community care. All right, so we need your help. We are noticing trends that you need to discuss the care with your primary care provider. They will put in the consult and they will send it over to the specialty clinics, where the specialty clinics will pick it up, and then they will determine if they can schedule you in-house or if the care needs to be given in the community. All right? It starts with the primary care provider. All right? So the next one is to ensure the phone number in CPRS is correct. When we give you a call, we're calling the numbers that are on your face sheet. So if the phone number is incorrect, we're not going to be able to get a hold of you. And if we can't get a hold of you, we will then send an unable to contact letter to you through mail. So it's also very important you make sure we have the correct mailing address on file. All right? If you do not respond to the 3 calls, or 4 if it is mental health, and the UTC, the unable to contact letter, we will then cancel the consult, and then we have very frustrated veterans, all right? So when we're calling, please make sure you pick the phone up, or you can send us a secure message that says, I'm at work during the day, I need to get my consult scheduled, could you please call me at 6 o'clock? Then we'll have to take a look at what do we do with our team members to make sure that we can get a hold of you, all right? Because community care is open from 7:30 in the morning to 5 o'clock in the afternoon, okay? We kind of mirror the community care providers, and the times that they're open, all right? So answer the call. Sometimes Community Care and Optum will give you a call. And we have started taking a poll with our veterans to see, like I'll call from my VA cell phone and I'll ask the veteran, what do you see when I'm calling you? Some of them will say, I see you're calling from the VA. I had a couple tell me only my phone number showed up, and some said, I see you as spam. All right, so we are working on that, so please answer the call when you know a Community Care consult is there, or again, contact us through secured message, we are answering them, and let us know, hey, I've got a Community Care consult and I'd like to see this person, can you give me a call, I want to get scheduled, all right, and we'll work it from there. Attend the appointment. We have a lot of veterans that will get scheduled. We let you know that we've scheduled you. You've got your letter that we send to you. We even drop it into secured messaging at times when the veteran requests. We'll send you the authorization, and then you don't attend the appointment. Then we start calling all over again to see, can we get you scheduled, can we get you scheduled? So two things can happen. If you cannot attend the appointment because work comes up, life comes up, and you've got to reschedule with the vendor. You do not have to wait for us to reschedule. Okay, go ahead and make that next attempt to schedule. All right, you can send it to us through secured message that says, hey, I didn't get to attend my appointment on July 1st. I had to reschedule to July 8th. That's fine. We'll change the authorization dates, make sure you're covered, extend you out for that extra week so that you have the time frame you're supposed to based on the guidance that we give for the length of time you'll be in the community, and then we'll go from there. Or if you don't want the appointment, you no longer need the appointment, you went under private insurance because I took too long, whatever it is, let us know you don't want the appointment anymore so we can let your internal providers know, hey, this veteran does not wish to have their appointment anymore. You might want to reach out and just follow up and make sure they don't still need care with something else. And then we'll keep it going. But please attend the appointment. The other thing that can happen is if you need us to reschedule you with someone else because maybe you had a negative interaction with that person at the desk trying to get rescheduled, let us know. Because our vendor relations team will reach out to find out what is going on and why was the interaction negative. All right, that's very important to us that the vendors in the community are also respectful towards the veteran as we expect you to be respectful to them as well. Okay, and my team has to be respectful when they're calling. All right. Respond to the vet text for appointment attendance. Some veterans have signed up for vet text. And you will receive a vet text that sometimes can look a little strange that'll say, hey, you had an appointment on July 1st at 8 a.m. in the morning. Did you attend? We are trying to get better with that and connect it to the specialty clinics so you'll know it's cardiology, it's physical therapy, because some of our veterans live in very rural areas that they cannot get to the Atlanta VA, and they might have cardiology, orthopedics, and PT in the community. Which one are you talking about? So we're working on that. But if you could answer back, yes, I attended, no, I did not, we can then also look at that information and determine, hey, I need for you to go call Veteran Hollis and find out what is going on. Does she need to be rescheduled because we're still in the authorization period? Okay? Or do I need a new consult because the orders have expired? Okay? So super important. Any community care concerns, please send it to Ask Community Care a Question, all right? You can put bills in there. You can put questions about your consults. You can let us know you had a negative interaction with the call center, because then we're going to call you and ask you what number did you call, what time did you call, what phone number did you call from, because we can actually pull it out of our call list, all right? And we can see who answered the call and which telephone AMSA responded to you, and then we can go from there. One point of interest here, if you call the call center, it doesn't always come to community care. We do have a very large call center team that is in a different area. There's about 200 of them that answer the calls, and so you think you're talking to community care, but you may not be, all right, because the calls get routed to make sure they can be picked up. And so knowing what your phone number is and what time you called is very, very helpful so that we can go in and find out, did you make contact with community care and was it us? or do we get our other call center involved to find out who picked that call up? All right, but we are paying attention to that, and we have conversations every day about ensuring that our team members are respectful when they call you. Okay? If not, we want to hear about it, send it through secured message so I can immediately take care of it. Okay? All right, that's all that I have for today. I hope that you all have a great day, and I'll be in the back if you have questions.
So next up, I think that we're going to go by the safety story and move to our social work presentation with Miss Kimberly Whitmore. She is our Chief of Social Work here at VA.
I'll tell you, I think. Okay, sorry. Hi, everyone. It's nice to see so many of you here. If I start going too fast, or if you can't hear me, just wave. The VA is the biggest employer of social workers in the country, and here at the Atlanta VA, we have a pretty robust team with the biggest numbers of social workers providing services in our mental health clinic. They provide therapy and other care to people who are seeking mental health care, and our homeless program, which is a large kind of self-standing program that's out at the Fort McPherson campus. But if you come to the Atlanta VA and you need a social worker, or you think you may need a social worker, I wanted to go through some of the typical ways you might encounter social work staff. The sort of the front line, the first place a lot of people meet a social worker is when they come to the emergency room. We have social workers 24/7 in our emergency room who do triage and therapeutic care for people who are having either, emotional problems or people who are having functional problems at home. They'll see you in the emergency room. We have both a sort of a general emergency room team and a geriatric ED that provides services to people who are older who are having problems. If you're not sure that what you're having is an emergency, but you'd like to talk to someone, we also have the front door, which is kind of the first level of our emergency room care. And they'll assess you, talk to you, provide triage, help you get to the emergency room if that's where you need to be, or help you get resources and referrals for follow-up if you're safe and stable. I've got the contact numbers here where you can reach front door during our business hours. They're happy to take a call from you and help you get to where you need to be. When you call mental health staff after hours, the operator generally will get you in contact with one of our emergency room staff who can talk to you if you need to do that, and you don't feel like you need to call the crisis line, which is 988, and of course that you can call at any time. Our homeless program is a pretty large program that provides services out at our Fort McPherson campus. But we also have outreach staff who will visit veterans who are homeless, who are anywhere in the community. Our CRRC is what we call our Community Resource and Referral Center. It's often our first stop for vets who need homeless services. And we've got the number here for both our CRRC and the National Call Center for Homeless Veterans. If you call them after hours, they will get a message to the CRRC that you to let them know that you need outreach. And like Ms. Hollis said, or like Dr. Hollis said, we really do. Having a good phone number and a phone number that you'll answer is really, really critical for us, because we get a lot of calls that we try to return and have a difficult time reaching the person. We also have several programs under that provide emergency, very rapid rehousing if people are in a crisis. So please call and ask and talk about the resources if you feel like you need that. The program does operate under HUD guidelines, so we use the HUD definition of homelessness and their income limits, but the CRRC staff can talk to you about that if you think that that's something that you need. One of the other really common needs for us is folks who come in through primary care. Each primary care team has a social worker assigned to it. These social workers, they have a relatively large number of veterans on the primary care team assigned per social worker. But if you mention to your physician, or if you mention that to the MSA, or if you tell the nurse that's triaging you that you're interested in seeing a, am I not telling you to move? Sorry, I did not let her know to swap a slide. Here we go. So if you're interested in seeing someone, mention it to your primary care provider, or to your or to the nurse, or to the MSA, and they can certainly set you up with a social worker that's providing care in that clinic. They get a lot of requests for things like people who are having difficulty with finances, for people who are having difficulty coping at home because of a medical or a mental health emergency, for people who are struggling with living independently and who need resources. So this is a very common thing that they talk to folks about. They also can be a conduit if you need it to see somebody who is a more specialized mental health person and you want to talk to someone about what the steps for that would look like. We have a team that works with Dr. Hollis's team in community care that is specifically taking care of veterans who have been admitted to hospitals in the community. So if you or your family member has been admitted to Grady or Northside and you need to talk to a social worker at the VA about what your care transitions will look like, I've got the number here for the supervisor of that team, and she will get you connected with the person who will work with the staff at Grady to make sure your needs are met. The staff at these community hospitals, we do outreach, so they should also know how to reach us, but sometimes they do not. So in case you're in a hospital or your family member is and you need to reach someone, you can call us and we'll make sure that they are touching base with the team at Grady or at Emory or at wherever you're at and coordinating the needs you have for discharge home. We've also got numbers on here for things like our dialysis staff, transplant care, our intimate partner violence team. If you are having concerns about safety at home, or if you feel like you might need assistance with managing your home environment, I've got our toxic exposure team, and you're going to hear more from our fantastic team for that, as well as our mental health team a little bit later. And we also have a program that's set up to help people who are transitioning from the military, and they have a direct line here that you can call. If you're a recent military discharge and you're having a difficult time figuring out your next steps or accessing care, then that's what they're here for you. Okay. Okay, next slide. Okay, you're ahead of me. All right, you saw me turn it over. We have a program here that specifically provides support to caregivers, and so there are two components to that. One is what we call the Program of General Services for Caregivers that provides rather exciting, I think, programming for caregivers and support. We do, they will have you come in and do fun activities. They'll provide education for caregivers on things like managing their mental health. We really encourage you to get involved in that if you're a caregiver of a veteran, because it's very, very valuable to it's very, very valuable information and supports provided. Everything from getting you CPR certified so that you can improve safety at home, to doing fun things like crafts and things with the caregivers and getting a little bit of a mental break. We also have a program called the Program of Comprehensive Assistance for Family Caregivers that is for veterans who are 70 to 100% service connected who can apply for that program. And at that number, they can give you more information on that. I've also included our national hotline, which will, if you reach them, they'll give you the information, but they'll also connect you to our local team. We have some interesting programs through our non-institutional care, including our medical foster home. We get a lot of inquiries about people for this program, which is a program that allows a veteran to live in the community with support, but they don't have to be in an institution with a caregiver who provides 24-hour care. We have also a lot of inquiries from people who are interested in providing the care, and I've got the number here for our medical foster home coordinator if you want to talk more about that. We've included the email address. If you're already receiving home health care, we get a lot of inquiries about this, so people who are receiving homemaker services, but they may be dissatisfied with the care. You can send a email with no protected health information. We don't want you to put your social in there or anything, to our homemaker team, and the person who is involved in nursing will call you back on that. And finally, if you are a veteran who's residing in a contract nursing home, then I've included the contact information there. You should maybe already know these folks because they're coming out to visit you every month. But if it's a new situation for you, or if you can't remember how to reach them, we want you to call extension 558-421 and make sure that we can reconnect you with your team if you're having any concerns. And I added a few resource numbers that you might find helpful. I included our transportation because that's a regular call we get. I put the link on here for the Georgia War Veterans Home, which is a unique resource for us here in Georgia. And then the information on here about how to access benefits and claims, but you may also get that from some of our other folks here today. And the very last resource I put on here is our Veterans Justice Program. If you have a veteran who may be experiencing a legal concern and you want to consult with them, you can also send an email to that group. Don't include health information, and they will have the person who is assigned to the county that you're concerned about call you back and help with that situation. So I'm sure that we'll be having some opportunities to do for you to ask questions during the Q&A. So I'll go ahead and pass this on to the next one. All right.
All right, everyone. So next up, we're going to hear from our Chief of Veteran Experience Office. Her name's Angela McCrory. And then what we're going to do is shift to Dr. Norvell for the safety story, and he can provide a brief overview of what HRO means and how it impacts veterans and staff. Ms. McCrory?
Good morning. I'm Angela McCrory, Chief Veterans Experience Officer, and I want to talk to you about the programs under me. We have patient advocates who assist with the coordination of care with patients or faced with barriers. Our patient advocates, they take calls all day and they see walk-up veterans. They assist with compliments, complaints. They do V-signals and My Healthy Vets throughout the day. They also coordinate care with caregiver support and clinical appeals. Our Red Coat ambassadors you may be familiar with. They're the ones that have the red coats, jackets, or vests when you come into the facility. They ensure a pleasant visit and provide a first impression upon coming into the medical center. They are a standardized navigation and wayfinding. We have 3 kiosks in the facility for wayfinding, 1 at each entrance point. There are some VAs that are calling me to inquire about our kiosk machines and ambassador programs as we're trying to get that to be a national thing. The Red Coat ambassadors are able to provide communications about the different services that we have in the facility. They provide clinic locations. They have access to the patient advocates as well as myself when veterans come in and have a complaint or need additional levels of care. They're able to talk to you about the PACT Act and My Healthy Vet. What I would like to know, I saw when we came up on the theme was let your voice be heard. This week we just launched a Commitment to Yes campaign where all the employees within this organization signed a banner committing to yes. Our Commitment to Yes is a move forward in our efforts to create a cultural transformation within our organization. We are striving to provide veterans with the best care and let them know that their voices are being heard. Part of that is building a culture and an attitude that eliminates the vocabulary of no. We're striving to build customer loyalty and promote a culture change. We want to aim for high veteran satisfaction and reduce veteran complaints. Not just for the veterans, but increase employee satisfaction and retention in this facility. I say all that to say that I want to hear from you all. And the way that your voice can be heard is by participating in the surveys that we have. There are 3 surveys that go out. We have a SHEP survey that you get home. I keep hearing that it's long. And recently I had a veteran say, what do we get for that? So I was like, that is a good question. Sometimes you get a survey, they offer you something. So I'll be talking with SHEP partnerships on next week. The other one is V-signals. You might get a text or email once you have an appointment. And that's a quick opportunity for us to provide a quick service recovery for you. Another thing that you might have noticed is that we have the pictures of the nurse managers and the MSA supervisors with their phone numbers in the clinics. We want to hear from you if you have a compliment or a complaint. We don't want you to leave the facility without giving us the opportunity to provide service recovery to you. The other survey that we have is called a Press Ganey. That's a clinician and group experience survey. So part of my job is to make sure that every veteran in this facility has a great patient experience, just an overall good customer service. I think it's my first time to see Ms. Hollis. I talked to her. I talked with most of the providers and different departments throughout the week regarding patient complaints. We just want to ensure that everyone has a great experience. And I'll be sitting here. I have one of the patient advocates here and one of the Red Coat ambassadors if you have any additional questions. Thank you.
All right, for those of you who are joining us virtually, hang tight. We're going to go to the safety story with our Chief of Staff, Dr. Robert Norvell. Dr. Norvell?
Thank you. So the VA is on a journey we're calling our high reliability organization journey. The tenets of, are the pillars of high reliability organization. Number one is our leadership commitment to a culture of safety, and that leadership is behind that, as well as continuous process improvement. We know that healthcare is one of those things that you continually have to work at to get things better. It's a team sport, and it requires the voice of everyone, the doctor, the nurse, the administrator, all to work collaboratively. What we typically do in our morning huddles and at meetings is we try to level set with a safety story. This story kind of tells us how we all fit into taking care of our veterans and giving them the safest and most quality care. So this safety story really meant something to me, and I wanted to share it with you at the Veterans Town Hall. On Saturday, July 20th, 2024, we had a CT technologist, that's the person that's running the CT scan, was completing an outpatient order for a veteran with prostate cancer. The outpatient CT scans performed on the weekend typically don't have a radiologist in-house, and it's stored in their red on the weekdays. While viewing the CT, the technologist noticed that there was a blood clot, a pulmonary embolus on the scan. Next slide. The CT technologist realized that this CT scan would not wait, could not wait, and should not wait until the weekend, or the weekday to be read, excuse me. She asked the veteran to remain in the radiology department, then reached out to the teleradiologist that was on duty and asked to have the scan read as soon as possible. That was very important because she's not a radiologist, but her suspicion was high. The teleradiologist physician read the scan and provided the report, which showed a life-threatening saddle pulmonary embolus. A saddle pulmonary embolus could break off at any time, and this person could have been dead. The patient was immediately taken to the emergency department and started on blood-thinning medication and admitted to the hospital. The result of this is that CT technician's quick action and preoccupation with failure, where every staff member is a problem solver, probably saved this veteran's life. So we have some alignments with our HRO journey, and they are supporting a culture of safety. It's about the veteran, committing to zero harm, and embracing a duty to speak up. The principles are, we are always looking at when something happens, because it's going to happen in life. Not that things happen, but how you look at them and how you say, how can we keep these things from happening? What are some of the things that we can prevent? And how can we anticipate these risks and then try to overcome them? Deference to expertise. The CT technologist knew that she could look at it and she sees them all the time, but she's not a radiologist. So she went to the right person that could answer the question and say, these are the next steps. And sensitivity to operations. Focus on the frontline staff, empower them and give them the voice to speak up and not to have their voice muted. I'm seeing this throughout our organization as we're moving forward. Atlanta, when I started, did not have a very good reputation, but I think these stories are the things that I need to share with you all because I'm seeing this, and that is what my job as the chief of staff here, the head doctor, is to make sure that everyone has a voice. Not just the doctors, because you know they have loud voices, but the administrative staff, all of those, and it's going to take this team in order to make things better. Thank you all for listening, and we'll move on.
Thank you, Dr. Norvell. And for those of you who have not met Dr. Norvell, he, I believe, celebrated an anniversary with Atlanta VA. I think he's been here for 2 years now, along with Ms. Ford, so thank you for your service to us. All right, next we're going to hear from one of our great colleagues across the Parkway, the Veteran Benefits Administration. So we're going to hear from Mr. Adrian Urbina.
All right, good morning, everybody. My name is Adrian Urbina. I am one of the Assistant Service Center, thank you, managers across the street. I tend to walk around a little bit, so this helps a lot. I want to thank everybody for being here today. It's nice to see everybody. For all the veterans out there, thank you for your service. Always appreciate it. So we're just going to kind of do a general overview of kind of what we do across the street at the VBA. I'm very excited to kind of let you guys know what we got going on over there. One of the things that we do have over there as far as the areas of jurisdiction is one of the places that I work, which is the Veterans Service Center, which we take care of your benefits. That's where the money gets paid. That's where we rate your claims. That's where we do all that. That's at the Veterans Service Center. We also have the VRNE, which helps veterans get reemployed. So they do a great job with it over there. They've got counselors. We have loan guarantee and the education. Okay, so one of the things that we do have over there as far as the primary jurisdiction, as far as for us, where we get the claims, that comes from a national basis. So all the claims that we do get aren't just Georgia veterans. They're veterans from all across the country with varying workloads, PAC Act, stuff like that. Then the VRNE, they do take care of the Georgia veterans. Next slide. Okay, so this is just a general overview as far as the PAC Act. You guys know the PAC Act, that's helped me as well. A bunch of different veterans. It's, in my opinion, it's one of the greatest things within the last few years that has helped out veterans. Kind of a little bit of a side note because, for example, I know a lot of veterans out there. You're like me. When I was in, I never went to sick call, right? I was one of those people. You got to go. I got a headache. No sick call. Got to go, right? You're the hardcore, hard-charging soldier. However, that kind of ends up biting you in the end. Why? Because there's nothing in there that shows all these disabilities, right? Hauling 100-pound rounds across the firing point. Okay, you're 28. Okay, I don't hurt. Now I'm 50s. Now I'm in my 50s. Things hurt. So the PAC Act really helped me. It helped out the veterans out there as well. So the PAC Act, what it is it expands eligibility to not only health care but benefits as well to different veterans with toxic exposures, Vietnam, Gulf War, and post 9/11 eras. So this shows some of the following presumptive conditions that we do that have been included in there: brain cancer, all these different cancers, melanoma, neck cancer, pancreatic, reproductive, respiratory, right? That's also a cancer as well, okay? So these are the things that they do that has been included in that. Next page. Can everybody hear me okay? Okay, all right. All right, so this is just some of the stuff that, who's eligible under PAC Act. We did talk about the Vietnam folks, but this kind of covers as well some of the people that served on or after September 11th in the following locations, right? Then we also have the people like myself that served on or after August 2nd, 1990 in Iraq. So these are just some of the places, and really what it boils down to, when in doubt, put in a claim. Right? If you're in doubt, put in a claim. What's the worst they can tell you is no, right? But if you don't put in a claim, you never know. Okay. Okay, so this is just some of the PAC Act data for the veterans here in Georgia. So it's for you guys. So the distinct claimants is 68,468, completed claims 68,018. Processing times, 166.1. It's a little bit over what we like to see. What we like to see, 125 days or less, right? So with the number of claims that we've gotten, the more claims we get, the slower the processing time, right? So we're trying to, on the next slide, not yet. On the next slide, I'll address that. We're doing a big hiring push to try and help that. So the grant rate is 72.1%. Granted claims is 49,795. Pending claims is 16,328. Some net of awards, look at that, 267,435,239.51. That's a lot of, that's a lot of coffees, a lot of donuts. That's a lot of assistance for veterans for the Georgia veterans. All right, next slide. Okay, so these are some of the most common granted PAC Act disabilities: allergic rhinitis, the hypertensive vascular disease, maxillary sinusitis, bronchial asthma, and malignant growths of the genitourinary. So these are some of the ones that we've granted the most of. Next slide, please. Okay, so this is just the national data across the country. The average days, fiscal year to date to completion is 152.6. Like I said, what we'd like to see is under 125 days. We're kind of above that. The daily production is 9,981. Fiscal year to date production is 1,911,885. Next slide, please. Okay, so like I said, the backlog, which is over 125 days, that has increased, right? With the number of PAC Act claims that are being put in, it's putting a big strain on our system. So what we had to do is we had to increase the staffing. We had to hire more people. That's 56.8% increase in staffing nationwide, right? That's for the PAC Act. That's here in Georgia. That's the call centers. That's all the way across the nation. That's going to help for the backlog. All right, so I'm really excited about this. This is ADS. Okay, so this is a new system. It's an automated decision support system. So what we're trying to do here is we're trying to automate the process, automate tasks and workflows. So this is not an end-to-end thing. This is only in the gathering of evidence that goes to the claimants. So we do realize that with the backlog, right, what we have to do is we have to, like they're doing with the AI initiative to help out with the records, we're kind of doing the same thing with technology. What we're doing is we're trying to automate the gathering of the evidence. It's just a tool that focuses on administrative activities that helps us get your claim to the processors, to the raters. That isn't going to change. Somebody else is still going to look at your claim. They're still going to look at the evidence. They're going to take a look at all the data, all the stuff that we've gathered together. It just gets it to them quicker, right? Because if we can get it to them quicker, then that gets the decision to you guys quicker, right? That's the hope. So some of the things that this will do is it reduces the time spent on administrative tasks, right? Because as you know, that includes gathering medical records, gathering service records, DD-214s, kind of all this stuff. That can be time consuming. If we can automate that, that leaves more time for the actual people to take care of other things. So what it does is it provides a nice document with an evidence outline of all the key information that they're going to need to process your claim. So another thing that we hope is that it enhances accuracy and consistency, right? We want the decision that you get at the Atlanta VA to be the same as the one you get in Seattle, North Carolina, South Carolina. Consistency is key to get you guys the right benefit at the right time for the right amount, right? Because we want it all to be accurate. So that is a little bit about the ADS system. We're trying to automate it to make it quicker. Like I said, it's not an end-to-end. We're not going to have this system rate your claim. That's still going to be done by a human being. We're still going to have the human touch on that. Next slide. Okay, so this is, you guys may know that we do host monthly claims clinics from 4 to 6 p.m. So we try to have those each month. These claims allow you guys to work with claims processors to answer general questions, specific questions, and different claims. So there is the website as far as for information, scheduling appointments, and whatnot. Okay, next slide, please. Okay, so as you guys may or may not know, we do see veterans across the street at the public contact. They've done a lot of work to make it more comfortable, right? The waiting area is really nice. They've got TVs. They make it more comfortable for you guys to sit. So we do in-person and virtual appointments. Walk-in appointments, you just walk in through the guard, go to the right there, they can help you guys out. One of the things that they do is they help you with claims, file claims, maybe if you have any evidence that, hey, we need your DD-214 or we need this, you just come in here and you give it to us and we can go ahead and get that uploaded. So what you can do is you can go on to the website there to do virtual appointments, or you can call that number, okay? So we also want to know how we're doing. As with the rest of the VA, we don't know if we're meeting your needs if you don't let us know. That's really important, right? Whether it's at the medical side or over across the street, we want to know exactly how are we doing. If we have any shortfalls, we need you guys to tell us so that we can fix it. If we fix it, we want to make your guys' experience better. Because ultimately, who are the people we serve? You guys. Okay. Thank you very much. Oh, just real quick, we do have a table out there of individuals that can help you guys out for specific or any claims-related questions as you go out the door to the right. There are the table over there. All right, thank you guys very much, and I appreciate your time.
All right, so next up, we're going to hear from Dr. Pittman. She is our Women's Health Medical Director. Before Dr. Pittman takes the mic, what I'd like to remind folks inside and outside is that we are winding down on time. So what we want to make sure that we do is get to your questions as best we can. For those of you who are joining us virtually, we may connect you with a member of our presentation team or our leadership team who can answer your questions directly, make sure that we have good contact information for you. There are roughly a dozen questions in the chat already, and I'm guessing we have roughly 20 to 30 individuals in the building, which means we're going to be cutting it close on time, but we want to make sure that you get your questions answered. So with that in mind, if you have questions that are personally detailed in nature, when we get to the Q&A, we'll ask that you get connected with a person one-on-one, so maybe we don't have your privacy violated, and then the folks who are joining virtually can still get some of their questions answered as well. All right, next up, Dr. Pittman.
Hello, everyone. Good morning, good morning, good morning. Thanks for hanging in there with all of this information. I know it's a lot, but it's good information, and I've enjoyed the presentations thus far. My name is Dr. Jamia Pittman, and I am the Women's Health Medical Director here at the Atlanta VA Healthcare System. Thank you to all of the veterans attending today, and a special thank you to the women veterans that are here today. Welcome, welcome, welcome. I just want to tell you a little bit about the Women Veterans Program. The Women Veterans Program is a program that's kind of like, if I can use an analogy, we're kind of like a hub and we have spokes. So the Women Veterans Program is a hub where we have a multidisciplinary and interprofessional team that is dedicated to the needs of the women veterans. What that means is that we have a social worker Women Veterans Program manager. We have myself, MD, Women's Health Medical Director. And then we also have care coordinators that are nurse practitioners, PAs, social workers, and we all work together to, in a hub fashion, influence the care of women veterans all across the Atlanta VA. And we interface with all of the service lines because we have to have partnerships, right, in order to move forward. And so some of those relationships, some of those service lines that we interface with have allowed us to increase the offerings for women veterans over the years, and we hope that the women veterans feel and appreciate and enjoy some of the services that we have now that maybe we didn't have about 10 years ago. And some of those include mammography care coordination with the help of our community care partners. Women veterans can get mammograms at over 40 sites of care across the Atlanta area through community care. In addition, we have a team of navigators that works to ensure that we coordinate that care. Once you get that result back, if it's not normal, then you need to know the next steps. And our team reaches out to you and is accessible through InReach to them to help coordinate that care. During the presentation for community care, there was an ask, and the ask of you guys was that you collaborate and communicate with your PAC teams regarding your community care. I would like to echo that ask and be a little bit more specific when it comes to women veterans. I would like for the women veterans, once you get that mammo result from Piedmont, Kaiser, Northside, please share that information with your PAC team through uploading through My Healthy Vet, if you're able to do that, or through taking a copy by, or reaching out to your PAC team and saying, hey, I have my result, how can I share it? And we will reach out to you and help. What we're finding is that it takes partnerships for us to be able to care for you within the VA and across the Atlanta area through other healthcare organizations. And not all of the outside healthcare organization electronic health records and systems interface directly with the VA. And so we have to go look for our results. And you guys get the results sometimes, especially for mammography, sometimes faster than we do. Now, having said that, yes, we go after the results as well. We have different ways of doing that in partnership with community care, but anything that you can do to help us is really appreciated. Now on to maternity care. I got to back up. The Atlanta VA serves the largest number of enrolled women veterans in the nation at 27,000. So we have a large footprint of women veterans that receive their care at this site, at the Atlanta VA. And so because of that, we have to have more and more offerings. One of those offerings includes maternity care coordination in partnership, again, with community care. We have over 250 pregnant women veterans at this time receiving care in the community to help deliver their babies. And it's a wonderful, wonderful thing to support new life and family planning. And so we have to coordinate that care as well. So we have maternity care coordinators that reach out to the veterans every few months, ask what's going on. We also have expanded that care to include care after the delivery of the baby. And why is that important? Why is it important that we talk to the woman veteran after delivery? Does anyone know? Right.
Just collaboration is new. You're changing.
Exactly, because that's a new experience for the woman veteran. And we know that that postpartum period is a period where some flourish, but sometimes the woman veteran needs assistance with mental health, assistance with just navigating what it's like to have a newborn and sleep deprivation, assistance in some cases with intimate partner violence that has sprung up as a result of the change. And in other situations, the woman veteran may have had preeclampsia during pregnancy and now has hypertension. And so we have to interface and engage the woman veteran to make sure that we reconnect her with the primary care, make sure she's on the right medicines. So that maternity care expansion for following the woman veteran up to 12 months after delivery, we support that now as well with care coordinators dedicated to that. In addition, we have reproductive health. So I'm switching gears a little bit now. Reproductive health. That encompasses everything from birth control, contraception, Plan B, to infertility, to planning for pregnancy, and it also encompasses abortion services should the woman veteran's life be at risk. So we have a hub of providers and spoke influences across service lines to help ensure that we get the right care to the woman veteran at the right time for those concerns. And then in the midst of all of this, sometimes we need the mental health psychology support, and we also interface with our mental health service line and social work service line to provide that type of support. So I could go on, and I'm not, because I was told about the time. And so we're going to move forward and talk about our focus groups. This is where we get a lot of our information. We have focus groups that include women's-only groups, and we sit and listen to the concerns of women veterans quarterly. We've learned a lot from these focus groups, and a lot of the programs that we have now are a direct result of the focus group information, data insights. Next slide. Now, the platform where I can go on is our Women Veterans Only Town Hall that's coming up. It's going to be on August 20th from 5 to 6 p.m. I think it's going to be in the chapel on the main floor. We are so excited about it. Women veterans, please bring your women veteran friends. Please attend and tune in to those online and virtual. Next slide, please. And then last but not least, we have heard the voice of the woman veterans say that they want to see images of women veterans displayed more often. They want to see media. They want to see postings about offerings for women veterans and inclusion of women veterans. And so we are gearing up to meet that need. We've done some critical things to meet the need, but I did want to highlight this one offering that's been offered nationally, and it's a wonderful podcast for women veterans. And during this podcast, you can find out information about all types of offerings for women veterans. They talk about pregnancy loss. They talk about celebration of women veterans. They talk about unique things that are really important to women veterans. And so if you have a moment, please tune into that podcast to find out more information about what the VA is doing to take care of all of the women veterans that have served, because the women veterans population is one of the fastest growing populations of veterans using VA services across the nation. And next slide. That's it. This is my contact information, and the Women Veterans Program Manager, Kathleen O'Loughlin's contact information. And we also have a wonderful Women Veterans Call Center. We love the call center because, number one, it's for women, by the women, and it also helps to, if there's difficulty with other call systems and call centers, we get the information directly, and then we can, in a hub and spoke manner, reach out and connect the woman veteran to what they need. So please take advantage of that as well. And that's all that I have. Thank you for your time.
Thank you so much.
Yes, thank you.
Just want to echo Dr. Pittman's invitation to make sure that you attend the Women Veterans Town Hall. It will be here on the campus. We have a couple more presentations left. So next up is Miss Whitney Jackson with our Compact Act, and then we're going to hear more about PACT Act. We might go through some of those slides because I think they're information that has been shared multiple times, as well as in the back, and then we have the claims clinic as well. And then we're going to hear about a call to action for volunteer needs. Then we're going to get to the Q&A.
Good morning, everyone. My name is Whitney Jackson, and I am one of 2 Compact Act coordinators here at the Atlanta VA. The Compact Act of 2020, the purpose is to allow the VA to expand access to suicide emergent care for eligible individuals by covering costs, thereby removing the cost barrier. The impact is that by extending eligibility and access to acute and follow-up suicide care, the net of protection VA will provide to prevent suicide increases dramatically. And this in turn increases eligibility to an additional 9 million unenrolled veterans, potentially doubling the need for services. What does the Compact Act provide for veterans at risk for suicide? It provides 30 days of inpatient or crisis residential care and up to 90 days of outpatient care, both of which can be extended for 30 days if necessary. All care, inpatient or outpatient, can be received within the VA facility, or if the veteran chooses, it can be received at a non-VA community care provider. Coverage for suicide emergent associated costs include medication, emergency transportation, and medical services if there is a suicide attempt where the medical services are also needed. As of right now, July 2024, we have received approximately, because this was from last week's numbers, 595 referrals. We have confirmed 338 of those referrals. 257 of those referrals are either unconfirmed or out of catchment area for maybe Augusta, Dublin, some of the other VAs within the nation. Next slide. How to report. There are 3 ways to report. You can report through the VA's emergency care reporting portal, the emergencycarereporting.communitycare.va.gov, or by calling 1-844-724-7842. And then if you are a veteran who is trying to appeal the decision made related to the emergent suicidal care, you can contact the patient advocate office, who will be able to assist. You could contact community care. You can contact patient advocate or the Compact Act coordinators. I and myself and Ms. Lamisha Edie, we can be reached at 404-321-6111, extension 204970. And we'll be happy to assist in any way possible. We also have a few resources. There's a brochure that's available, and we also have a frequently asked questions paper. Again, myself, Whitney Jackson, and Ms. Lamisha Edie, we are the Compact Act coordinators for the Atlanta VA. We can be reached at 404-321-6111, extension 204970, and I will be here if anyone has any questions afterwards.
All right, next up is Ms. Kamari Stanley with our PACT Act and toxic exposure navigation.
Good morning, everybody. Like she said, my name is Kamari Stanley. I am a social worker and one of the PACT Act navigators for the Atlanta VA healthcare system. So Mr. Urbina already gave us some information about the benefits side of the PACT Act, so I'm not going to touch too much on that. But I do want to let you guys know what we're doing with the PACT Act here on the healthcare side of things. So after the PACT Act was passed in 2022, it has allowed every single veteran enrolled in VA care nationwide to receive a toxic exposure screening. So what the toxic exposure screening is a brief 5 to 10 minute conversation between yourself, the veteran, and your healthcare provider, where you talk about your history with military toxic exposures during your service. That way, of course, if there's any healthcare concerns or anything needed there, your doctors can kind of address your care to be exposure informed. Again, the screening gets done every 5 years for our veterans enrolled at the VA. And during the screening, you have the opportunity to, again, discuss your history with exposure and gain connections to benefits, registries, veteran service organizations for claim assistance, all kinds of stuff during that conversation. And then your responses, of course, are recorded as part of your VA medical chart. So it's very important that if you haven't received one already, we want to make sure that you do that with your primary care provider. So that way, if you do have any history of military toxic exposures, we want that definitely documented as part of your VA medical chart. So far, for the Atlanta VA healthcare system, we've completed over 105,000 toxic exposure screenings, and about 42% of our veterans here in Atlanta are endorsing exposure to something during their service. So again, it's a pretty high number of veterans who have experienced this, and that's why we want to kind of start the conversation. Also wanted to use this time to kind of quickly dispel some of the common myths that we hear about the toxic exposure screening. The first is that the toxic exposure screening is not going to be a comprehensive exam. You're not getting a physical exam. We're not diagnosing you with anything. Again, it's just a conversation to kind of discuss your history with exposures. It's not directly linked to VA disability benefits, so while you may receive information about where to go to file your claims and things like that, by doing a screening, you're not automatically entered in for benefits, so you do still have to file a claim separately. It's not a verification of exposure, so something that we commonly get asked is, can we use the toxic exposure screen to prove to benefits that we were exposed during our service? That's not how it works, just because this is a self-report, so we're not fact-checking, we're not double-checking, we're just taking what you said and incorporating it into your healthcare. So you can't use it as a verification of exposure. And then another common thing that we get is a lot of veterans think that it's need-based on service connection percentage. So veteran might say, I'm 100% service connected, I don't want to file a claim, so I don't need to do a screening. While you don't need to file any claims or do anything that you don't wish to do benefits-wise, this screening, again, is to make sure that your healthcare providers are informed about any exposures that you may have experienced. So it's definitely still important to get your toxic exposure screening despite your wish to file claims and do benefits. All right, and then very briefly, I wanted to kind of plug this resource. It's an app called Exposure Ed. It's a free app that you can find on the App Store, or you can scan the QR code there. And it gives you really good information on education about military toxic exposures. So for those of you who may not know if you were exposed or may not know how your exposures could have impacted your health, this is a really good way to find out more, because you can search by location of service, conflict, time of service, things like that, and just get more information about, again, how it could have impacted your health, where you go to file for benefits. If there's any of those presumptive conditions related, it'll tell you there in the app. So just download that and take a look if you've got any questions about military toxic exposure. And then last thing, we wanted to kind of tell you guys about our upcoming outreach. What my team is responsible for is educating you all and your families about the PACT Act and toxic exposure screening. And we do so by coming out into the community and doing these outreach events. Usually at all of these events, there will be claims on site for you to be able to file claims and check the status of things that you've already filed, as well as on-site toxic exposure screenings. We will have medical providers on site to be able to knock those screenings out for you if you haven't done it already. So here are 3 of our upcoming events that we encourage you to come and join, and hopefully we get to see your faces there. And then if you have a community organization for veterans and you would like our presence at one of your events, we try to, contribute in any way, no matter how big or small. So please give us a call or an email if you're interested in seeing us at an upcoming event, and we'll see what we can do. And I will have a table out in the lobby with the claims processors as well. So if you've got questions or concerns about PACT Act, don't know if you've had your screening, you can come and visit me. I'll look up your chart and let you know. Thank you.
All right, next we're going to hear from the fearless leader of CDCE, which is formerly known as Voluntary Services, Ms. Gwen Ramos, and many members of her team are here today. Take it away.
So good morning again, just echoing what everybody has said thus far. Thank you all for being here. Thank you for your service and your time. We appreciate you coming out on a Saturday to find out more ways to help us improve in the treatment of your care. I am Gwendolyn Ramos, and I'm the Chief of CDCE, formerly known as Voluntary Services. That means Center for Development Civic Engagement. All that means is we are more outreachable, we're more in the community, we're more out there so we can get these resources to you and help in your care. Listed here are our volunteer needs. As Ms. Cook stated earlier, we are at a moment of call to action for volunteers. So if you are interested in volunteering for the VA to help support all of these wonderful services that were just spoken about moments ago, these are some of the areas in which you can help provide some support. Also, we are DAV drivers. I'm hopeful those vans will be on the road by October. We will be starting to do little bit of transportation in Covington and just trying to get our feet back wet on getting veterans back to their appointments. But by October, we should be fully operational. Our vans right now have been serviced. They are getting road ready. So hopefully that service will be available come October FY25 so our veterans can, that is one important service that we need to be back on the road to get these veterans access to care. And if you're interested in volunteering, please reach out to us. Our points of contact, I have a card. If you're interested in reaching out and finding out more about our services and how you can support, just ask me for a card and we'll be happy to gather that information for you. Thank you.
Okay, so this is the part that a lot of you wait for, and just so you know, under our new leadership, we're going to have less presentations in FY25 and more Q&A. So I know that that is good news to a lot of the veterans and caregivers in the room. I want to be mindful of folks' time and respectful of time, and so we are scheduled to go until 10:30. For the good of the order, it's 10:16 right now. We have over 15 questions in the chat alone, and then I know we have folks here in the room. So one of the questions, I'm going to do my best to go through the ones that probably won't be as detailed so that we could get some quick answers, and then you all do have access to humans in the room. We have resources in the back, and then we also have folks in the hall who can answer a lot of questions too. The first question that was asked earlier on in the beginning of the town hall was, what's being done to improve veterans' access to our patient advocates? So how many patient advocates do we have, and how do we know if we reach out to the patient advocates if our calls and messages will be returned? So that would be for Ms. McCrory. So if we could get her a mic, please.
So we get a lot of calls every day. The patient advocates do the best they can to answer the calls. Nationally, we get the most complaints, I would say. We have about 8. I'm in the process of recruiting additional patient advocates. And what was the last part?
It was a question about phone messages not being returned.
So when the patient advocates take a call, they enter them to our PAT system, the patient advocate tracking system. And if you're not getting a call back, it's the patient advocates take the call. They're coordinating your issues. Either they're going to round them up to specialty clinic, primary care, community care, something of that nature, and it's to them. They have 7 days to get a call to you and a response so that the patient advocate can close it out. So the patient advocate is just a coordinator, if you will. If you have any issues, call me. I'm the chief, and I'll try to assist.
Thank you. Next question, real quick, I'm going to do 2 here. We're going to do one or 2 in the room, and then we're going to go volley back to some of the ones in the chat. It's the most diplomatic way that we can configure at this time, so please be respectful of that. The next question was regarding community care, and I know Dr. Hollis had an alibi. So the question says, what can we do when the PCP does not submit community care referrals properly? They are often using the wrong diagnosis information, urgency level is incorrect, and community care facilities are not receiving our paperwork. This has happened on a handful of occasions, and sometimes it seems that no one on the VA team knows what is happening. So can you respond?
All right, so when you reach out to your primary care physician, if the diagnosis codes are incorrect and you feel like the paperwork is not there and the consult is not moving, send us a secured message and let us know what that concern is. But 9 times out of 10, the AMSA that is trying to schedule that consult has already let the nurse know, and we have pushed it back to your primary care provider. The primary care provider will then take a look at it because they start the consult. They don't approve it, they start it. Then what will happen is we will also engage the specialty clinics. So let's say it's orthopedics because your right knee hurts, but it's actually your left knee. we will outreach them, asking them to make those corrections on that consult so we can get it back and get it scheduled out into the community. There are some things that go wrong with the community because they're not always going to give us quick information back. Some facilities are using schedules 3 months in advance, so we have to wait for it to open, so your packet will sit a little longer than what's normal. That was identified with the OIG this week, and so they are taking a look at our Mission Act to see what can we do to get the community to also help us ensure you get timely care and not have to wait a month for the schedules to show up and for us to get you an appointment. All right, but that is what we are doing. The nurses are 9 times out of 10 already on it, already alerting the internal providers to get it corrected. But please do let us know through secured messaging if you feel we're not working fast enough, okay?
All right, thanks, Dr. Hollis. I know I saw a hand going up. Renee, if you could get a mic to the veteran in the middle. Thank you.
Yeah, I got it. Yes, my question is concerning mental health. I've been a mental health patient from VA since 2011, where we were coming here to the VA, but with COVID, they stopped that, but then they started back after COVID. Our peer support person here at the VA retired in February. Since then, we don't have access. We can't come to the VA because the excuse I've been given time and time again is that the VA has a freeze on hiring. But that doesn't make sense when you do have access, a peer support person at Fort Mac that trained here that could fill in that position. And the veterans are going on the 4th floor that's been in my group to see through the psych ward. They have all kind of issues. So I told them I would be coming to this town hall meeting to give them some type of results, if there is any. You can't go upstairs to the director's office because they don't have an open door policy anymore, like they did in the past. So what is going to be done? These veterans are still suffering and do not have access to any type of mental health because the VA has really a bad history of dealing with mental health patients, and it doesn't seem like it's getting any better. It's gotten worse. That's my question.
Thank you for that. Actually, I'm working with the mental health chief because, as you said, we did close down during COVID because we couldn't have people in. They are supposed to be starting those groups back up. I will get a timetable so that we can send out when we start those groups back up. But the mental health leadership was made aware. I was made aware of it at the last town hall, and I asked them why we had stopped it. I think it was our Vietnam veterans that told me about it. See, look at that. I told you. I met with one of them afterwards. We talked for about an hour, and he explained to me exactly what you said. So mental health has given me a commitment that they're going to get those back up and started. But like I said, the reason we stopped them was because of COVID, and it wasn't safe for people to be meeting in groups together. But they are supposed to get, and it's got nothing to do with hiring and the hiring freeze. But, well,
We were back here, and the only reason we're not coming back is because our peer support person retired.
okay.
Since they retired in February, they haven't replaced them. So it didn't have anything. This is February of this year.
Okay, so then I will check with mental health and find out why we stopped having those appointments. But I thought it was another group that happened prior to COVID. This is a recent group. Okay. All right, thank you for that.
All right, we're going to move on. We've got one more hand up. We got a mic over here, and we'll get to you, sir, in the middle next. Remember, please don't share any personal details. If you need to have a one-on-one consult, for those who are in the room, we will offer that when the town hall event actually concludes.
So maybe I'm a little confused as to how a town hall works. No? Better? I thought we were coming here to be able to like voice our concerns. And it seems like you just said we have 7 minutes left. So how do we, and the director isn't here, so how do we anticipate change if we are not able to voice our concerns?
You are able to voice your concerns. What we're trying to do.
But if you have 7 minutes left, you guys took up all the time.
What I was explaining is for those who are joining virtually, so that we could try to do our best to answer some of the questions that they've posed. There's over 15 questions in the chat, plus we have folks in the room. So the folks who are in the room, we're asking if you have more detailed, involved questions and you're sharing personal information, that we can connect you with a staff member who is here, who's asked to be here to answer those questions in the interest of time. But yes, you are allowed to voice your concerns.
Okay,
So
so
please
my-
ask your question.
Okay, so my concern is that, it's not necessarily a question, this is what I'm about to say, is that I may have an issue that another veteran has that is not here or can't ask that question, and if I can ask that question in this forum, opposed to one-on-one, then, it is, it's a question that's out there that is known by everyone and not just Dr. So-and-so heard Natasha's question. Do you understand my concern? It's like, I can ask the question,
Yes,
but
I
someone
understand.
else might. Yeah.
I understand that, and so
And
we have
so-
been offering resources in the chat. Everything that's been presented, we've included that. We have all of the telephone numbers, we have all the contact numbers, and then
Yeah, but
so,
that again is.
do you
I'm
have a
sorry.
question?
Is the director going to be here?
The director is not here right now. He is not here, unfortunately. Like I made the announcement earlier, due to unforeseen circumstances, and that's why we have members of our ELT team who are here in his stead. So if you have a question, we will do our best to answer it. If you don't, we'll move on to a question that is in the room, and then we'll move on to some virtual questions. Yes, sir.
Yes, there, I read that there was a fire at a medical records facility that destroyed some veterans' records. The fire that was in the medical record facility, how do the veterans find out if their records were destroyed in that fire or not? Is anybody aware of that?
Is this in reference to a VBA fire? Do you know which part of Veterans Administration was impacted?
No, I'm not. I read the article online, and it said it was Army.
Do you know
and
when
Air
the fire
Force.
occurred?
July 11th.
Of this year?
This year, yes.
And was it here in Atlanta? Is that what
It
you're
didn't
asking?
specify which facility it was.
That sounds like something that we might have to get more information on. If someone can answer that confidently, please feel free to step forward.
So, if you give me your name and information, I'll find out and coordinate. I know there was a St. Louis fire, but I haven't heard of anything like recently. Okay? So not like in July of this month.
And there was a couple different branches of service that affected, and there's been workarounds to try and assist the veterans that affected. But at the VBA, we have not been informed of any recent fires with veterans' medical records.
It's July 11th. Army, Air Force personnel fire records destroyed.
Where?
More than 3/4. I'm just looking at the, it's in,
Does it tell you if it's active duty records? Is it at an actual office fire? Do you have any more details? If not, we can ask someone to connect with you here in the building like we suggested,
the
and then we'll,
National Personnel Record Center.
okay.
Of St. Louis?
So that's not here in Atlanta, is what I'm hearing. Okay. We're going to move on to a couple of questions that sound like they could be answered by some of our clinicians. What is being done to ensure that veteran records are accurate and accessible in Blue Baden? I don't know if that was a misspelling. And then the second one was, when is the Atlanta, Blue Button, yeah, it was a misspelling in the chat then. When is the Atlanta VA going to be integrated into the MHS Genesis?
I'm not familiar with MS Genesis, and I'm looking at other clinicians here. You do? Okay, Dr. Pittman.
As a part of, I'm a part of the SAIL committee, which is, I'm not going to remember all of the acronym right now, but it's basically the Strategic Analytics Improvement.
For Improvement and Learning.
For Improvement and Learning, the SAIL committee. And one of the key topics on the SAIL committee is the topic of care coordination and documentation. And we have an initiative right now where we are working to ensure that when your primary care provider or your specialty provider cares for you, that they update the problem list. So in addition to documenting in the note what's transpired, they are to also go into the problem list and put the new diagnosis and update the problem list so that when you're seen by the next provider, that information is updated. And it's an area where we know that we need to improve, and we have work groups working across the enterprise to do that. Hopefully that answers that question, that first one.
All right, I'm going to couple two more questions. How are VA directives being trained, enforced, and violations being addressed if VA providers are not held to the same ethical and legal standards of accountability as private sector providers?
So one of the things we're doing with looking at those directives is a lot of the directives that come out are national directives. We had some local SOPs, but we're now transforming and transferring us to those VHA directives, and we are implementing that through our quality management and then disseminating that out so that all providers know that we have national directives and we should not be following the local policies, because there are things that have come out nationally, and in the past VA was allowed to do their own what we call SOPs, standard operating procedures, but we all know that we must start, first of all, with the VHA directive, and we have to be no less strict than the VHA directive. And so we are moving to VHA directives and getting away from standard operating procedures.
Thank you, Dr. Norvell. We have a question in the rear, then we're going to go to the question in the middle here in person.
Good morning, everyone. I have a question. I would like to know what is being done, if any, to help vets get access to dental care. And I know when we're in the service, we did have access to dental care, but once we're out, we have no access to dental care. And I do not take anything away from the 100% vets that do have it, but as far as those of us who do not have 100% for dental care, isn't that part of healthcare as well?
So it is part of healthcare, but that is one of those things that goes back to the last one. We have VHA directives and we have a eligibility requirement that will have to be taken up with Congress, but dental is actually one of those things that has VHA directives and we have to go through dental eligibility. So it's not something that locally we can make that decision, like I was talking about not following VHA directives. That's one that actually is congressionally mandated as far as how we can give dental care. And so we can't make a separate decision here locally, but it is something that some of the veterans organizations can help to kind of change. But right now, there are specific eligibility requirements, and so not every veteran is eligible for dental care.
All right, and then we have the question in the middle.
Well, I actually just wanted to say that the blue button is in secure messaging. You can hit on it, you can press the link for that, and it brings you to your Army medical records, and it's supposed to open it up so that you're able to use it. It does not always work, but it's there. So that's where the blue button is, and the secure messaging. I wanted to say to the person who does the patient advocates, they're amazing. I had to go in person to see them. I did email them, and I live in Kennesaw, Georgia, and so I did email them, and I never ever got a response. However, the person that I did talk to when I came in person for a appointment, he was amazing, and my issue was resolved before I could even get out of that appointment, and so I applaud you for that. But my question is to Mr. Terrence Richards about the beneficial travel. Sometimes it comes up where it's like it's a link that you can click on, and it lets you check in, and then it actually has a link at the bottom that allows you to do the beneficial travel. That doesn't always come up, so I don't know who's that responsible for that, but it's just random for certain visits that it'll let you check in and then let you do the beneficial travel. So why is that, and why come that can't just be a general thing? And my second part is, when are the kiosks coming back? It was so easy to just go in and click do your beneficial travel, and all these other steps are just kind of difficult for, I think, the more senior of the veterans to have to go through 17 steps just to get your beneficial travel.
All right, so that's a good question. So what I will say is, you know, VA infrastructure for the websites can be a little wonky at times. So whenever you have those issues, if you'll report them to us, we'll make sure that we put in tickets for those things to see if there's a glitch that's going on that we can get fixed for you, because you shouldn't be having that issue where it's not coming up for you the same way every time. So it may have something to do with whatever network you're on and some of our security settings, right? So anytime you have those issues, let us know so we can report those. As far as the kiosks are concerned, that is something that is definitely on our radar. We already have plans to purchase new kiosks to put throughout the organization. One of the main reasons for that is to help with Benny travel. We do realize that it's much easier to drop that claim in on a kiosk on your way out the door to make sure that you get that in before you even leave. And again, getting that in the kiosk electronically to us helps us get that turned around to you relatively quickly. We see turnaround times around 4 or 5 days when we can get those in electronically through the kiosk. They can self-adjudicate and process that payment quickly.
All right. Do you have a question about Benny Travel, sir? Go ahead.
Why does it, when I go to a VA appointment, it costs me money because the travel claim check doesn't buy the amount of fuel it takes to go there? It costs me, for 1 gallon of gas, $3.76. I went to an appointment in Stockbridge from my house, and I got a check for $3.63.
So that's something that we can take a look at, see if something went wrong with your claim. But what I will say is we do not set the rates here at the Atlanta VA. The rates of reimbursement are set nationally, so we have to follow those national guidelines for the rate of reimbursement, and we have to pay you to that closest facility depending on what's going on with your appointment. So we don't have direct control over what the travel payment you will be provided will be, but we can review your claim with you to make sure that everything was done appropriately and we did pay you the maximum amount allowable. You had a question, sir?
Excuse me. I had a question. Well, first of all, I wanted to say something. You said that this town hall would be put on your website. Is that what it is?
Yes, so this will be added to the YouTube page, not the website,
The YouTube
to YouTube
page.
and Facebook.
Okay, I just wanted to double check on that. And the thing that I wanted to ask about was about claim sharks. In my organization, the VFW, we're going to be talking about claim sharks this month. This is our initiative, talking about how to stop seeing these people. Anyway, the reason people go to claim sharks are because they say that, I know for myself that these people say that they can help you to get what you need to get from the VA. And I'm sure everybody can agree with that we're trying to get our benefits and services. Anyway, I wanted to ask, if you put someone on as helping you to get your benefits, is the VA paying them or something? I mean, because...
No, we are not. The organizations that we, I don't want to say endorse, but that we send people to are the DAV, the service organizations. Those are the ones. And I know this isn't my wheelhouse, but I know, for example, like attorney fees, there's a certain cap that's set, a percentage as far as that goes. But we do not endorse or send people to any of the claim sharks. That is not a practice that we do.
And someone else in the chat, sir, did have a question for VBA. Who do we reach out to get feedback with issues, and is it tracked when we connect with the VBA? And are the screenings automatically done, or are they by request only? So it's a little combo.
Can you repeat the question, please?
So if someone has an issue with VBA, they want to know who do they reach out to, and is it being tracked when they have feedback concerns?
Yes, I know that we have an online, which is Ask VA, and that's monitored. So we do correspond with the people that do that, and I know that we are held accountable for the Ask VA. So that's one of the ways that you can do that. Also, you can come into the to the public contact area, and they will address your questions and concerns there as well.
And then I think it was for Ms. Stanley. Is the screening automatic or is it by request only?
So the toxic exposure screening is typically done automatically when you come in for a primary care appointment at the VA. If they see that you've never done one, it will show as due in your VA chart, and they will complete it during that setting. But you also can reach out directly to my team to request one same day, and we will go ahead and knock it out over the telephone with you versus having to wait for your primary care appointment. So it can be a little bit of both.
And then we have a question in the room as well.
I'm not a fan of pharmacological treatment for a lot of things due to the unintended side effects and so on and so forth. Does the VA offer osteopathic treatment services for PCP? And who do I talk to about getting assigned to one?
So we actually have Whole Health, and it has those integrated things that you talk about. So one of the things that I do talk about is not only our journey in HRO, but our whole health journey. So we have things such as mindfulness, feedback, chiropractor, acupuncture. Dr. Stephanie Brown Johnson is our whole health lead, and we can get you contacted with her. Your PCP actually can send you to some of those, but they have to know about it through Dr. Stephanie Brown Johnson, because I can tell you I use like just some mindfulness when I'm working in the emergency department, and I don't give you like drugs. If I'm reducing a hernia, I actually had someone to do some deep breathing. Breath in, breath out. I reduced the hernia, and he's like, oh my God. Typically in the past, one of the things we would have done is probably given him some pain medicine, but I said, work with me. I said, let's just do some deep breathing. I'm gonna tell you what I'm gonna do. I reduced a hernia in the emergency department, told him what it was about, and I didn't give him pain medicine. I'm like you. When I go somewhere, what can I do naturally? What can I do without having to take a pill? Because I understand the consequences of a pill going through your body and coming out. So the VA is moving in that to have alternative therapies. Battlefield acupuncture is another one, so for back pain. We're going down with battlefield acupuncture and things of that nature. So Dr. Brown Johnson, Stephanie Brown Johnson is our.
We have flyers in the back.
Are-
We have flyers in the back.
We do. Some of our physicians are DOs, believe it or not, and some of our PM&R specialists and things of that nature. So when you talk to them, that's one of the things you have to let them know is that I may not want medicine. What are some of the other alternatives?
Who do I talk to about having my PCP be a DO?
That would actually go through Dr. Lambert, but I don't know if we always have a DO as a provider, because we do use nurse practitioners, physician assistants, MDs, and DOs are hired. So we don't discriminate as to who is hired, but as some of our specialists are DOs, and they do other things such as PM&R. So a DO is an osteopathic doctor who's gone to school, and they do other things other than just medications. Okay. You would have to talk with Dr. Lambert to see if we have one, because I can't say that we actually have one. Can someone get this gentleman the contact information for primary care? Will you do that, Renee, so we can get that information to you? All right.
All right, and then just for the good of the order, one of the conversations back and forth in the chat is there's a feeling in the chat from veterans that they need to be able to address their concerns, and they think that they're only being heard if they do White House or congressional complaints. And so they want to know when complaints are brought forth, how do we best handle them, and just want to know if they should continue to use those. Someone said you should go to the White House, Congress, OIG, and the Joint Commission. So we do have venues for those, if anyone from our ELT would like to speak to that.
Okay, that's an awesome question. Earlier we talked about our commitment to yes. You'll see I'm wearing a button that says, how can I make your visit better? We just passed this out to 100% of our staff. It is our ultimate goal for that not to be the way that you get your problem resolved. Because what it does is you put that complaint forth. It goes the whole way up and it comes the whole way back down, and we're spending our time, instead of addressing and helping you, we're spending our time on the back end trying to answer the complaints. And it is just a cyclical pattern that we're we're having difficulty getting out of. Now, I do understand, as we improve our system and you get better customer service, what does that do? It improves trust, right? You have to trust us to address your concerns. This is a huge initiative at this facility to make sure that all of our staff understand it is everybody's job to stop and take the time and answer the concern and help the veteran. To stop giving you instructions to walk all over the building, but walk you there and get you to your designated location, assist you at that time, and provide real-time service recovery. Our patient advocate group works tirelessly to address those concerns on a regular basis. And if you're not getting the response that you need, or you're seeing repeated patterns, you need to go through our PAT system. You need to go through our advocates so that we can go and look at them. We look at them every day and we track and trend those patterns to try to make sure that we can add institutional improvements.
All right, do we have any more? We have one question in the back, and then we're going to close. We're at 10:45 respectfully. Well, there's a person in the back who's standing. We'll get to the one in front and the middle next. So the gentleman in the back is getting a microphone right now.
Well, just to piggyback on what the madam just said, is that I did go through the system with the patient advocate and everything, and this was just last month, right? And I'm not going to mention the advocate's name, but that's a whole nother story. I had an issue with the VA, Lawrenceville in particular, and I had to go through John Ossoff, the congressman, right? Went through all that, and then got a little response back from the VA, but yet when they signed the letter, there wasn't a human person. It's so inhumane. There wasn't a human contact. It says something like congressional liaison. That was it. No name, no contact. So I called patient advocate to find out who, and so I can get my questions answered. She wouldn't give me the person's last name. She said, well, Miss Pam, we'll call you back on such and such date. By the way, just come to the town hall at the end of the month. But yeah, we went back and forth, and we got heated discussion. She said, just come to the town hall. But yet still again, are they hiding the high officials? Why can't I know the name of the congressional liaison who's supposed to be helping me? She wouldn't even give me the lady's name.
Well, she's here right now, and she's wearing the red, and she's standing with the microphone. Her name is Renee Francis Turner.
She's here now, but that's not the thing. We don't solve problems here. Why can't we?
I understand that, but I just want to be clear. We are
get
public.
those
We are
things done
public
when we
employees,
talk
so
to
we
the
do give
advocate's
you our
office?
names.
So I can actually address that concern in a slightly different way. When we respond, Ms. Turner is not the one that can always resolve your concern, so we take it down to the frontline customer that can. If it is a primary care concern, primary care is who resolves it. If it is mental health is who resolves it. We work tirelessly to try to make sure that your concern gets to the right place, and we do have a requirement for the point person to be at the bottom of that letter if you have any further concerns. And it maybe didn't happen with the letter that you received, so we'll talk after this about your personal situation. Absolutely. But it is our goal to make sure that you do have the information you need to get back to us, okay? So that is our standard and our requirement. If it did not happen in your case, then we will talk about it offline after.
Okay, Renee, go ahead.
Hi. I'm basically, what you just addressed and the guy that you're talking to addressed, I have a similar problem. But my problem has been going on for over 40 years. And I am basically being denied rights as a veteran. I get nowhere with my claim. And that's at all, because right now I try not to make waves, because that's the way I was taught, to try to be cordial with people. But I'm actually now going up a chain of command where I'm getting ready to send a letter to the Surgeon General, because I'm not getting anywhere with my claim. I mean, I've been through every process that I could do for 40 years, and I'm not getting
So
anything.
what sort of claim are?
Is it possible that you and Mr. Urbina could talk one-on-one off to the side?
Yeah, we can
Is
talk
that
after
okay
this.
with you?
Yeah, we don't want to expose your personal.
Oh, okay.
Okay, good call. Yep. Okay, good call. Yeah,
All
we'll
right.
talk offline.
I'm a doctor. I'm not supposed to be telling everybody's business. So
And then, I'm just trying to get to the last few questions. If a veteran is being medically neglected, how do they get help? And why are providers not assisting veterans with nexus letters and DBQs as noted in VA Directive 1134?
Good question. So that's a combination of also how we do our claims. There's been some concerns on the physician side that if they are writing those letters and then treating you, then how are they separating their treatment from then assisting a claim? I'm working with my primary care because we have to look at that directive. That directive has specific things that it does, such that it keeps the primary care provider from being the person to make the claim. As you see here now, VBA has a claim side, and then VHA has a medical side. So I'm going to provide you medical services no matter what, but should I be making the determination that you have a claim, because we have a process for claims. So that's been one of the biggest concerns that has come to me, that primary care providers don't understand their roles when writing a nexus letter, and so they don't feel comfortable. That's for me, for the chief of staff, to make sure they understand what their role is. And if they're not comfortable, don't just say, I'm not going to do this, but elevate it to somebody so we can find out why. That's one of the commitments to Yes that I'll be working with. That's a huge one that I've heard come up before, because the veteran wants the primary care provider to write a letter that they assume will just automatically give them a claim. It's similar to what you were saying. As a doctor, I took an oath. I'm not going to say that I'm going to give you a claim, because that's not what I went to school for. I went to school to take care of backs. I went to school to take care of prostates. I went to school to take care of hearts, but I didn't go to school to do the claims. That's a separate section, and sometimes when you start mixing money up with healthcare, then it doesn't become ethical. And so I'm always going to be the doctor that I went to school for. If I wanted to be a policymaker, I'd be up in Congress. But I'm a doctor, and I'm trying to make sure that I give you the right care. And so I will work with my team of doctors to look at how we can get to Yes. But I do think there may be an ethical issue for us saying that you should get 10% or 20% or 30%. Dr. Pittman and I have both been in that situation. We will write the letter, we understand how the letter goes, but some providers don't understand that. Dr. Pittman has been with me many years, and she said, yeah, I agree, I'm gonna write the letter, and I understand that I can't tell the veteran that they're going to get service connected from the letter, but I agree that I know how to write the letter. There's training that we went through. It's called compensation and pension training. It is as least likely as it's all these possibilities that most doctors didn't get trained on how to do it. Unfortunately, I started as a primary care doctor, went to CMP, went to leadership training, so I know all the difference, but not every primary care doctor knows how to write a letter, a nexus letter, and feel comfortable.
Thank you. I just want to kind of expand upon that briefly. That's why a lot of times we will send it to the outside contractors that we have for the exams. They are trained to do the as least as likely as not. If when we get your claim and the individual, the employee that's going to be rating your claim, deems that whatever medical evidence, whether it's a letter, whether it's anything like that, the exam is insufficient, a lot of times we will send it back to those companies, to those physicians, to do an exam clarification. Hey, we've got this, can you clarify on an as least as likely as not basis based on the medical evidence of record, whether this is due to service. So they are specifically trained to handle those, whereas, for example, your primary care physicians may not be.
All right, with that, we are going to call time. We are at 10:53. We're scheduled till 10:30, so I want to thank everyone who's here in person. I want to encourage you to connect one-on-one with questions with staff who are here, and remember that the claims clinic and resources remain available in the atrium. And to our online guests, thank you for joining us, and thank you for your questions today.